Welcome to the ear infection webinar. So we are going to, debunk a couple misconceptions that are, that we're being told as parents when it comes to ear infections. And then we're going to get into, that missing link behind, ear infections and why kids are struggling with so many recurrent ear infections. And getting into, the mechanism of what is truly going on, and then getting into, what it is that, we can do with chiropractic and why we see such great results when it comes to getting relief for these kiddos. So let's get into, let me just get things going here. Let's get into the workshop, the webinar. So now, let's get into a little story about one of the kiddos that we've seen in the past in our office, and this one really sticks out when it comes to ear infections, because it is one of the most severe cases of a kid that I've seen with ear infections. So mom brings in 13-month-old baby boy. Mom is exhausted. Mom is tired. Mom has been to multiple providers and tried a ton of different things. I'll get into that in just a second. Mom's little boy has been dealing with ear infections since 6 months of age. So he's 13 months now. So 7 months pretty much. Not a single day has gone from the first ear infection without a day of relief. So for nearly 7 months, this poor little boy has been in discomfort, inconsolable, just crying constantly. Mom has been to pediatricians, ENTs. She tried multiple doses of antibiotics, too much that mom lost count. Has had 2 sets of tubes. Nothing has touched it. Mom is just tried different remedies, essential oils, these things. Maybe got a little bit of, lessening, but still struggled. And, mom thought this isn't gonna ever resolve. And we'll finish up her story at the end, but, I hope that, maybe your kiddo hasn't had, ear infections for 7 months straight, but, even if they've had, 2 in a year time span, that's still a struggle. That is, kids are meant to be healthy. Kids are not meant to deal with ear infection after ear infection after ear infection. Kids nowadays are not healthy. Our kids are sicker than ever and dealing with so many more struggles. And, ear infections, they are very common. So the first myth that I want to debunk is that, ear infections they're common. We're being told that, they're normal. Don't worry, your kid is just going through an ear infection. This happens. It is a normal process. All kids go through it. And yes, 85% of kids by the age of 3 will have dealt with at least one ear infection. But I'm here to tell you that, just because they are common does not make them normal. Again, ear infections are not a normal process, and kids should not have to struggle with recurrent ear infections. The second thing that I want to debunk is that we're being told that, as parents, our kids' ear infections are bacterial. And, when it comes to the ear infection that we're going to be talking about, the most common one that our kids deal with, which is otitis media ear infection, which is a middle ear infection. 80% of those ear infections are viral. And, this is important because, what is at stake here? Every round of antibiotic, because, with ear infections, the most commonly prescribed thing is an antibiotic. And with every round of antibiotic, that is going to then increase our child's risk of asthma. Now, there are side effects of antibiotics constantly, and one big one is resistance, and this is a huge concern nowadays because of the overusage of antibiotics. And if these bugs keep on getting stronger and stronger because they become resistant to antibiotics, when we need those antibiotics for something that our body can't actually fight off, we're going to need a stronger and a stronger and a stronger dose. And the issue is there's only so strong of a dose when it comes to antibiotics. So we want to then make sure that we have that antibiotic available when it is absolutely necessary for our body to get the help when needed. But if 80% of otitis media ear infections, which are the most common ear infection that our kids deal with, are viral, meaning 8 out of 10 kids have a viral ear infection, antibiotics are only going to help 2 out of those 10. And and parents tell me this, they say we're prescribed an antibiotic, and I ask, did they culture to see if it was bacteria or viral? And they said no. We don't know if it's a bacterial or viral until we actually do a culture swab. And also, when it comes to guidelines that pediatricians are meant to follow, their guidelines say that when a kid gets an ear infection, they should have a 3-day waiting period before doing anything, because most of the time an ear infection will clear up. But then if we are going to prescribe an antibiotic, we need to do a culture. So again, the main two types of ear infections that we see with kids is otitis media, which is the one that we're going to be talking about today, and then otitis externa, which is that swimmer's ear, which we tend to see more in the summer and the spring when we start kids go swimming in the lakes and the pools and that stuff. So let's get into, we got to talk about the body when we're going to be talking about ear infections. And 80% of our body is made up of this one thing, and that is H2O, water, right? Water. We have that fluid throughout our body, and it's helping our body with the healing process, helping carry, white blood cells, all these platelets, these important things that help with that healing process. And fluid, fluid needs to keep moving though, constantly in the body. If it stops moving, that's when things start to become stagnant and bacteria or viruses start to come into play. So what I'm going to dive into now is, why is that fluid behind our kid's eardrum not moving? This is the missing link that nobody is talking about. This is what, as a chiropractor that focuses with kids, that we can help with, that can keep that fluid moving, and then your kiddo isn't getting these recurrent ear infections. Okay, so now 50% of ear infections are going to most likely present with a fever. Now, so 1 out of 2 kids. Now, let's also talk about, the other kinds of signs that we see with ear infections. So, kids that are teething, they become more susceptible to ear infections. And why is that? Is because, teething is going to bring fluid to this area of the body. And teething is so hard for our kiddos. They say that actually most adults wouldn't be able to survive teething, because it is actually so traumatic for our kiddos to go through. Now, they are way stronger than, we give them credit for. When we go through teething, our body needs to bring fluids to that area for healing. Now, if our kiddos' ears aren't draining the way that they should, what happens is that fluid lingers and can get stuck behind the eardrum. Second thing is then congestion, especially in the Midwest, with these temperature differences, especially, even in the last 4 days here. We had, 70-degree weather on Monday, snow yesterday on Wednesday. When we get these drastic changes like weather, our body tries to produce more mucus. And when we see kiddos with runny noses, congested sinuses, that's another sign for us to make sure that their ears are draining properly, because that sinus congestion can migrate to the ear, and if the ears can't drain properly, it builds up. Now, another thing that you will most commonly see with your kids is the tugging, the pulling of the ears, and what they're trying to do is relieve that pressure. So the important concept here that I want to make sure is that fluid needs to keep moving. If fluid builds up in our body and gets stuck, then that's when infections can occur. And in particular, in this case, if fluid gets built up behind that eardrum, we get an ear infection. So what is this mechanism of ear infections? And before I get into that, the most common error in communication to parents that I hear from parents is that we're being told as parents that ear infections are a result of their tubes being more horizontal. And when you see my beautiful drawing here, I'll show you that. But let me debunk that. Yes, ear tubes in kids are more horizontal. So yes, that is a true statement that they're horizontal, but that's by design. It is not a flaw in our kids, okay? So, everything in a kid compared to adult is a lot more compressed. They got a smaller head. And as we age, then it expands. So same thing with our ear, our tubes. They will then become more vertical as we age. But in healthcare, we don't understand absolutely everything. And you know what? That's okay. As long as we are continually trying to learn and that stuff. But you know what? We don't need to make excuses for things either. So, we'll look at my beautiful drawing here. So we have the ear, okay? And we have the eardrum, okay? Now, that fluid right here, this blue, if you can see, that's the fluid that gets built up here. And, we have these marks here are a muscle that surrounds this tube that drains the ears. Now, when that muscle gets stressed, or more specifically, when that nerve that supplies the muscle gets stressed, it will then clamp down and narrow that tube out. So when the nerves in that upper part of the neck, they get irritated, they get stressed, it causes the muscle to tighten and narrow down and clamp down, and then fluid gets trapped. Now, we call this muscle, this fancy word we call Tensor Veli Palatini. I love saying it. But it is, it's an important muscle because it is what drains that ear. And when we have that tension and stress in that upper part of the neck, a muscle cannot function properly. So, now that we have this fluid built up here, the only way, and I don't fault pediatricians because this is really the only way that they know to get fluid out, and that is through the use of tubes. So they're looking at more of an artificial way of draining the ears instead of looking at the root cause of why the ears aren't draining in the first place. So, they drill a hole into this eardrum and they insert a tube. All right, so now we have an opening in that tube. Well, in some kids this works, and then some kids it doesn't. But for those kids that it does work, how it works is like those water jugs that you can buy. You can you put in your fridge. It has that spout, and if you open that spout, water trickles out. But then if you puncture a hole in the top, or if it actually has an opening, what happens is that water shunts out. And that's what's happening here in this case. So this fluid that's stuck here gets shunted down the tube because that outside pressure is forcing that fluid down the tube now that has been there for how long. And what it does is it pushes it right into the next catch-all. And well, the next catch-all for us in our immune system are these two things, and these are our tonsils and adenoids. So what we see is it drain right into our throat where we have the tonsils and adenoids, and that fluid kicks to our tonsils and adenoids and we start to see them swell. Well, what we commonly see is then now kids, are maybe having troubles kind of breathing. They may have snoring at night. They may have sore throats. And then we have to then go back to the ENT, and instead of putting in tubes, because, they already did that part, they decide to take out these structures, the tonsils. And, instead of allowing the ear to drain the way that it was supposed to and allow the tonsils to drain the way that it was supposed to, we pull out the tonsils. Now, unfortunately, again, history then repeats itself. And what that does is, with that fluid that once was stuck in the ear, then that gets stuck in the tonsils, now starts to go, and hopefully you get the representation, goes right into the lungs, the guys down here, okay? So what we start to see now is that these kids start to have cases of bronchitis or pneumonia or even chronic asthma. So once we do those tubes, it just pushes that fluid from one area to the next in a forceful manner, okay? So if we help this tube here, this tube that actually is supposed to drain the ears, that's surrounded by this muscle, if we allow this tube, to drain and expand naturally, what happens is that fluid trickles slowly, and it's not going to then overwhelm the tonsils, and then it's not going to overwhelm the lungs. That's the difference, is instead of, forcing the fluid down, this muscle can then work, we're trying to get this muscle to work properly, so then it can allow that fluid to trickle slowly and allow that immune system, allow those tonsils and adenoids to, do what they were meant to do and fight off everything. But if they get overwhelmed, it gets bombarded. So now in the beginning, I talked a lot about, movement, right? Movement being this key concept. And that's exactly what we're talking about now. We have to allow this tensor Veli Palatini muscle that is innervated by this top part of our neck, of our nervous system, to calm down so that it can start to release this fluid down the tube like it was meant to all the time, okay? Now, couple things that I want to go into that are some complicating factors that I want to mention, because these are going to be points where you'll be like, that's my kiddo. First one is intense birth stories, okay? when we get cranial pulling or we get tugging, or we use forceps, vacuum suction, or C-section, we commonly see ear infections in the future for these kiddos. Second is nursing issues. If the kid prefers, the right side or the left side over the other, this can be indication in that upper area of the neck. Another thing is, tightness, tension, or, torticollis. Those kids are more susceptible to ear infections. And, if you have a kiddo that has torticollis, that is muscles tense because that nervous system is under severe stress. So, if we address that underlying neurological issue, we see a lot of help with these kids that present with torticollis. The next one is, cranial flattening. Okay, and see this so much more, and this is such a pandemic. The bones on the outside, and there isn't just one bone. There's multiple bones on the outside, but those bones mimic all the bones that are on the inside. So if our cranial bones aren't lining up the way that they're supposed to, then they aren't going to drain the way that they should. And then the last one for complicating factor is, these gas pedal babies. And what I mean by that are these stressed, tense, colicky, gassy, uncomfortable. They're just super tense and tight. Those are, if you have a kiddo that has dealt with either one of them, most likely you are dealing with ear infections, or you're going to be more susceptible to ear infections. So where does chiropractic come in play here? Because chiropractic is really good at getting these kiddos to drain properly. Chiropractic's really good at helping their immune system to be boosted and work the way that it was supposed to. Two ways that we start to see this with chiropractic and ear infections is that, better drainage physically by removing that stress off the nervous system, allowing this Tensor Veli Palatini muscle to work properly and to then drain the ears the way they were supposed to. Second is boosting their immune system by stimulating a part of the nervous system that we call the parasympathetic nervous system. That part of the nervous system is all about this rest, relaxation, good digestion, proper immune system function. This is where growth and development occur for our kiddos. And this is especially, at any point in life, this is especially important for our kiddos in the 0 to 7 age range, to be in this parasympathetic tone, because they are going through so much growth and development as a crucial stage for them. Now, lastly, how do we know that chiropractic is going to help? And that is by getting your kiddos checked. We check to see what is going on with your kiddo. Is this the root cause of their ear infections, or is it something else? What we use in our office is we use state-of-the-art technology, and this is a scan of a kiddo that came in with ear infections. And just a general quick explanation of this: white is good. Anything other than white is telling us that we have stress interference to that nervous system. And where do we have that? We have that right in the upper part of the neck, right here, where that supply is to that muscle in the neck. Okay, so this is how we know for sure, can chiropractic be beneficial? When we start removing this stress off of that top part of the neck, we start restoring that function and start relieving that stress onto that muscle, and that muscle starts to then relax, and we allow that proper drainage. But I will be the first person to say, if you do need a consult with an ENT versus trying this route. But you know, when you try tubes and you've tried antibiotics multiple times, you know, you as a mom, you know, or if you're a dad watching this, something in you is telling you this isn't working and we need to try something different. Especially in, you know, that kid that I was talking about with his mom. So, you know, 13-month-old baby boy, mom brings him in, ear infection since 6 months, not a day in between, multiple doses of antibiotics, 2 sets of tubes, you know, tried all these different remedies. Nothing could kick that ear infection or those ear infections. So mom found out about us, came in, we did the scans, we found that stress in the upper part of the neck. We started doing very specific, gentle chiropractic adjustments to help relieve that stress off that top part of the neck. And you know what? Couple days into care, mom was ecstatic because you know what? Her son, for the first time in 6 to 7 months, has had days without an ear infection. You know what? As a parent, when you start seeing that your kid is starting to, you know, enjoy life, to thrive, to not have to deal with that struggle, you know, as a parent, that is the best feeling in the world. And, you know, it's not that as parents, we're doing anything wrong, but, you know, parenthood is a journey. And the more you learn, the more you can help your kiddo. So if you have any questions, please post them in the comment section. Otherwise, please contact us. We would love to see how we can help your kiddo. And thank you so much for joining me. Have a great day.